Now, to introduce our next session, we're going to start off with a small Menti, which I'm going to manage. 2 questions. Can we have the questions for global awareness come up on the... There we go. Can we all scan? Thank you. Look, everybody's scanned. No, a couple still scanning. Looks good. Looks good. We can go on to the questions. I'd like you to complete the sentence. AMR is like. Complete the sentence, please. Scary. Definitely. A tsunami. Whoa. Absolutely. Climate change, a dark cloud. Death. Climate change. Oh, a lot of you, climate change. Climate change creeps slowly but needs urgent action. Unknown, a nightmare. Death threat, complex. Incomprehensible, not silent. Whoa, disaster, a fact of life, epidemic, running out of time. Next problem among 1,000 we should tackle. Complex, long achievement. Oh, underfunded. A pain in the... What? Invisible enemy, a puzzle, complex, overrated, a challenge. Oh, a spring of water. All right, question number 2. Okay, let's go on to the next question. When we talk about AMR, we often forget. What do we forget when we talk about AMR? What do we forget? In case you've lost your card, your QR code. What do we forget? And of course, I can't see the answers if it's not on the screen. Oh, that's back. All right, there we go. Environment. Biosecurity, funding, NAPS, cost efficiency, collaboration. Epidemiology, the environment. Environment is big. Patients. Do we forget patients? All right. One Health, general public. All right. Companion animals. Oh, yeah. All right. Animal health, funding, big one. Okay. Look at that. Companion animals is coming up really high. Patients, citizens. But environment is still central. Okay, citizens, funding, environment, politicians play a huge role. Okay, here we go. Well, I think you have some thinking to do. All right, the team will definitely be working on some of these ideas. Politicians is big, citizens, general public. All right, funding is still there. Companion animals, big one. One Health. All right. I think that's fantastic. It is my pleasure now to call up the team to take over. Laura, I give the stage to you. Laura and team. Thank you. Okay.
Thank you all. So Richard from the coordination team and I will present our efforts in visibility, giving visibility to our work and results. We call it this working area. So let's start with a short video. We cannot hear the sound. Thank you. That was for the end. Go ahead.
So
Richard.
the video was nice, but it was very, very speedy. So in a kind of a repetition, yes, we have created a new visual identity. We've worked hard to refresh our image and straighten our presence everywhere.
And we also developed icons for each working area, so all of you feel represented. And we also have in our visual identity our One Health approach behind all our working areas.
And in terms of dissemination tools and promotional materials and templates, we have provided you partners with essential materials and templates to ensure that our EU-JAMRAI brand and our funder logo are consistently represented and reinforcing our initiative identity. The dissemination tool includes the new corporate videos, so the 1 minute and the 5 minutes ones that will be useful for everybody in order to introduce what we are, who we are, and what are our objectives.
And regarding our external channels, well, our website has already reached 17,000 views. We also reactivated our social media channels coming from EU-JAMRAI 1, Facebook, X now. LinkedIn was a new platform for us, and to date we have already 5,000 followers, 2 million impressions, and 40,000 interactions. We also send regular e-newsletters. By the way, if you have not subscribed yet, please use this QR code and do it. A new issue is coming soon with all the conclusions from this annual meeting. And we have given visibility to many internal events, your webinars, workshops, and also to our participation in 18 high-level meetings, including the United Nations General Assembly, the Ministerial Conference, the World Health Summit, when we saw all, leaders, healthcare authorities, scientists, wearing the right now 5,000 symbols that we have distributed.
So, talking about internet channels, we hold since the beginning of this year monthly thematic webinars so as to give information distributed among our partners and keep you engaged. We try also to disseminate internal communication along with a one-page, as much as possible, thematic summaries about the progress made within each group. And, well, we have this Teams space, which is dedicated to each thematic group with specific channels, but also to the whole consortium. It's really key for sharing our work documents, but also to enable you to get connected with everybody within the consortium. So use it.
And of course, we have a plan. We have a plan that will be our guide, and we have already submitted the dissemination plan, and it has been approved. A plan that we are flexible because we have to adapt ourselves to the new needs that will arise during our journey.
So, we are many in this room, but many in our work consortium, many organizations, many people. Well, we said it without realizing, but yes, take care of that as well. We are many contributors.
And we have a very ambitious goal. It's turning Europe a best practice region containing AMR.
We are many, but we are one, and this is really our motto, the power of being one. And perhaps sometimes it sounds realistic, but step by step, day by day, we are progressing in forming this, well, community working together, building a One Health world to reduce AMR.
And well, this is our mission. as the working area to give visibility to our results and to our progress and keep all of you updated and, of course, keep all the stakeholders engaged and feeling that, we are all working together in this collective effort. Thank you very much.
Thank you.
Okay, and now let's go to the next segment of our session, which is Renewing AMR Communication, and I have the pleasure to call my colleague Anna to the stage.
Hello everyone, my name is Anna from the communication team. I am going to talk a little bit about the challenge that we have about communicating AMR, but before we have a video. Thanks. I am sure that many of us agree that communicating about antimicrobial resistance is challenging due to the complexity of the concept and the broad scope of the topic covering human, animal, and environmental health. Research highlights the crucial role of emotions when communicating. Studies across advertising, marketing, health communication, and social influence confirm that effective campaigns drive behavior change by emphasizing rewards, showcasing positive outcomes, and evoking uplifting emotions. When people feel good during and after engaging with a health message, they are more likely to embrace it and take action. It is one of the main reasons why we have decided that building is better than fighting. And that is why our motto is building a One Health world to reduce antimicrobial resistance. The acronym is also a challenge when communicating AMR. It has been criticized for being inconsistent, abstract, and difficult to pronounce. So let's get to work. We are about to sign a collaboration agreement with the University of Granada, Spain, for reviewing and creating an effective term for antimicrobial resistance that is memorable, clear, and capable of generating an adequate risk perception in the public. Our audience is also a challenge because it is very broad and diverse. People are at the heart of any solution to antimicrobial resistance, from healthcare professionals to farmers, veterinarians, environmental experts, policymakers, at the general public. Everyone has a role to play. A people-centered approach recognizes that individuals and communities are not just facing the challenge, they are key to overcoming it. Among all these groups, we recognize the vital role of one in particular, not just as an audience, but as powerful allies in communication and awareness, and in health research, policy development. They are the patients. We also face the challenge of finding a symbol that unites us all. But despite the symbol, we seem to have found the perfect badge, one that is increasingly used and recognized worldwide. All right, we have a general idea about how we want to communicate AMR, but what actions are we taking to truly reach our audiences? Well, before starting to create new materials, events, actions, let's review key AMR messages and materials at the European level to ensure effectiveness, consistency, and avoid duplication. This will help identify best practices, gaps, and areas of improvement. Our partner, Fundesalud from Spain, leads this study. We plan a study across several European countries to identify barriers and facilitators in using awareness tools in primary and secondary education. Our Belgian partner, FPS Public Health, is leading this effort. EU-JAMRAI 2 environmental experts, with the support of the communication team, are mapping ways to go beyond traditional education. The goal: tailor learning to each profile and situation for effective AMR response. These studies will form the foundation of our awareness-raising plan, soon to be submitted to the European Commission. As they are still ongoing, the plan will remain dynamic, integrating new fundings to guide future decisions. We have already identified some key actions that we aim to implement in the coming years, but we'll talk about that later. Now, I would love to welcome to the stage to our panelists, Javier Yugueros-Marcos from World Organization for Animal Health, Pablo Sagredo from United Nations Environmental Program, and welcome to our online panelists, Sarah Earnshaw from European Center for Disease Prevention and Control, and Vanessa Carter from the AMR Narrative, and of course, Laura, that will moderate this roundtable. Laura, over to you.
Welcome panelists, Javier, Pablo, Vanessa, Sarah, thank you so much for joining us remotely too. Okay, so after this presentation, I will start with Javier. Javier, yes, you're the first one, you're next to me. So how do you think that communication strategies on AMR need to evolve, particularly on the veterinary sector and the use of antimicrobials in animals? And in your view, what are the main barriers and how these international initiatives and international cooperation can help to overcome them?
Okay, so this is 3 questions, 2 minutes. 2 minutes per question.
You can choose the first one, the one you like most.
So the red card is not applicable in this case. So thank you for the invitation. I just want to start by mentioning some examples of how life looks like outside this auditorium. And I'm going to start with the veterinarian perspectives. These are things that I have heard or that people have told me. So, for instance, I do not see much therapeutic failure. This is the veterinarian voice. I know, but do you know that how difficult it is to give a pill 3 times a day to a cat? This other molecule is much easier. It's only 1 pill a day. Owners do not follow the treatment unless it's easy to administer. Others are telling me, we banned avoparcin, and yet vancomycin resistance is still present in humans. So, and others are saying, what if what I'm using is not medically important for humans? Can I use that? So, From the farmer's perspective, some are telling me, I didn't know that what I could do could have an impact on human health. I do not really use antibiotics, but I didn't know why. I thought that it was just that regulators wanted to give us a hard time in our daily life. What else can I do when price market pressure is so high? Alternatives are too expensive to me. That's the farmer's voice. And then the general public, and sometimes not so general public, they are telling, but do animals really need antibiotics? Aren't they used because aren't they used because of intensive production only? But we are not using the same in humans, right? So we should ban the use of antibiotics in animals. So this is the reality outside of this experience auditorium, and these are the challenges that we need to face. And in terms of evolution of the AMR communication, I would say that there are 3 things to be done. The first is that we have to improve in how people understand the topic. It has to be simple, it has to be understanding the principle, it has to be something that they understand what's in it for them, what happens if it doesn't change, and what can they do. And one of the challenges I would like to throw here to the consortium is to find a unifying message. As you have seen, I have described 3 different perspectives from the professional world in the veterinary sector, farmers, veterinarians, the general public. We need something that is unifying all of them, even with the healthcare workers, with the people working on the environment, something that is unifying all of them with simplicity. And then we have to move them from awareness to engagement, and then international projects like this one can be very powerful for that. So I'm looking forward to the proposal that you are going to give us in the next 3 years.
Thank you, Javier. See, you answered the 3 of them wonderfully. Thank you. So, Paula, your report, UNEP's report, highlighted that the environment is strongly present in the 3 stages of AMR, not only development, but also transmission and spread, and also called for priority actions to address these key pollution sources. What role does awareness raising play in driving action on these critical pollution sources?
Yeah, thanks, Laura. So, of course, awareness raising plays a crucial role in curbing AMR in general, but also specifically in addressing that environmental dimension. And I think that's made very clear in the Bracing for Superbugs report that UNEP put out some years ago now. And this report actually highlights that need of increasing awareness raising as the foundation, again, to tackle AMR or to build a One Health world, as we're saying now. But also to include that environmental dimension. Because through awareness raising, we can definitely inform decision-making and policy interventions. We can promote industry's voluntary action also and responsibility. I think that is where awareness raising in addressing the key sectors that this report mentions, or the key players, right, and the economic sectors and their value chains come into play. Also, a very important part of awareness raising is to empower communities, engaging local communities that can also press governments to prioritize AMR interventions, but environmental interventions as well. And last but not least, driving innovation is a big part of this because, again, through awareness raising, we can stimulate investment in sustainable alternatives as well. And when it comes to communication strategies to target these specific sectors, I think it's important that we have a good idea of what stakeholders are on the table and that we understand and explain the role and the co-benefits associated with action in the environment to curb AMR. I think that's very important. And we'll probably have to communicate differently to each sector. When we talk to the pharmaceutical sector or the chemicals industries, I think there we have to advocate for minimizing discharges or for adhering to environmental standards. When we speak with agriculture or farmers, training programs were mentioned a lot yesterday, as well as reducing antimicrobial use or managing waste effectively. Of course, the healthcare sector, we still see the need for a lot of AMR awareness into medical education. So that was something that was also mentioned yesterday. And when we talk about the general public, I think here is where social media campaigns, community workshops, or consumer advocacy really is a key tool in communicating.
Yeah, very important to also have very clear identified audiences to really, drive change in the environment. And we are hoping to also contribute from EU-JAMRAI to that with our help from our colleagues working on the environmental sector. Vanessa, as a patient who has experienced an AMR on first hand and then the consequences, in your view, what are the biggest gaps and most urgent in communication?
Yeah, thank you so much. So I think that this has been brought up a couple of times, and I've spoken about this quite over the last 12 years as an advocate, is tailored messaging. That was just brought up now. So I think that what we're trying to do is we're trying to send out a general message at the moment, but let me just focus on human health for a second. With people with different diseases would understand the message differently or relate to the message differently. So I'll give you an example. I mean, I was a trauma patient. I had a car accident. When I started looking for posters or any information about AMR in the hospital or in the trauma ward, the poster that I saw had a message about not taking antibiotics for colds or flu. And that didn't relate to me. That didn't mean anything to me. So, here I was, somebody dealing with an MRSA infection related to trauma, and I was seeing this message related to colds and flu, which theoretically should rather be in a GP surgery's office, not outside a trauma ward. And so I think that, and I'm glad that Jelena, I just want to thank you for mentioning that webinar series that we did together. That this is where patient organizations really can play a role. In the UK, for example, our GP surgeries have thousands of pamphlets created by, patient organizations and so on, where theoretically, I mean, if we had to just put a one-liner in there about AMR, tailored to their audiences, it would be really wide reaching. But of course, one of the barriers to that is funding, and of course, getting those organizations to understand why it's so important to include that in their marketing. And then, of course, because AMR is so multifaceted, the gaps, whatever works in a high-income context will not always work in a low-income context. And so, being somebody that was born and, from Johannesburg most of my life to moving to the UK, we need to think very carefully about that, and that's why it's so important to work with local people to understand exactly what would reach their communities. And then something that doesn't come up very often, and this is purely from a patient perspective, is the conversations that we need to be having with our doctors, our healthcare professionals, our nurses, anybody that's in that care pathway, including pharmacists. Because that is our starting point of communication. We might not be looking for the messages, the posters and the posts on social media and so on. But it's when we have those conversations with our doctors that really matters. So I think we need to be doing more, because personally, when I've been prescribed antibiotics, in the UK included recently, I've had to ask the questions only because I know what AMR is. But it doesn't automatically come up. And in fact, when I had my MRSA infection in South Africa, the only way that I discovered I had it was because I knew that a colonized prosthetic had been sent for diagnostics. And I didn't understand why the antibiotics were working. So I was the one who actioned actually requesting a copy of that diagnostic. And that was the first time I learned about antibiotic resistance. So I would say we need to include that as well. Very important to train doctors how to have conversations with, or how to communicate AMR with patients.
Yeah, and actually also doctors need to have time for you, right? And not, have those quick consultations. And I also take the chance for all of you who don't know, Vanessa has created her own charity. So she knows well how hard it is to find funding. And it's I think that it's amazing that you have turned your experience into such a positive effort of giving back and informing to avoid that things that have happened to you cannot happen to other people. So we thank you a lot for that. Sarah, when it comes to the general public, well, evidence shows that the message is not reaching them. In your view, what are the most effective ways to inspire to action while simplifying the message, but being accurately, scientifically accurate?
Well, thank you so much, and I'm delighted to be here, at least digitally. I'm so sad not to be in Bilbao in person. I was hoping that I was going to be able to say something really kind of innovative and new, but actually everything that I wanted to say has already been said in some form or another. And so maybe what I can do is just try down to kind of 3 key ideas, which I think really sum up some of the fantastic points that everybody is making here. And I really want to just also give a shout out to Vanessa for the incredible work that she has been doing to bring the patient perspective to this complex and technical issue. I think it's just so important, and especially I really liked her point about the conversation between the patient and the clinician, and working there with techniques like motivational interviewing, for example. So my 3 kind of summing up messages maybe are this idea of moving away from only communicating about knowledge and awareness of the problem to also including messages which empower everyone to make a difference in their everyday lives, because everybody wants to be part of a community. They want to be part of the solution, but they need really simple instructions to be able to make very small changes in the context where they are. So that's my first key message. The second one is really on this point about tailoring of messages. We really can't communicate with one-size-fits-all messages and expect to have an impact. You know, and this applies to our strategies and interventions, by the way, not just we really need to understand and to meet the needs of our target audiences where they are, and the general public. You know, I'm a member of the general public, but I'm also a mother. I've also had a child suffering from a resistant bacterial infection. And so, you know, we really need to understand people where they are, and understand the context of where they are and what is possible, and give them these simple steps. And then I really like this idea that it really sums up, I think, what the EU-JAMRAI is doing, which is to create this synergy. And we have the possibility here with this platform and all these incredible people united in one health focus to really create messages that reinforce each other, so that we can all play to the same tune, and we can really try and create this whole of society movement that is needed to address antibiotic resistance. So I think nothing new in what I'm saying, but maybe kind of trying to capture things as 3 key strategies.
Great
Thank
summary,
you.
Sarah. You know, we will continue with you, so we make this a little bit easier, because this requires not only scientific and medical solutions. As you have said, we need a lot of social sciences and communication. How can we advocate to give social sciences the role that deserves? Because sometimes this area is overlooked.
Yeah, I mean, I agree, and this is something that I've been working with my whole career, really to try and bring the social and the behavioral sciences into the public health work in general. I've been working with vaccines, I've been working with pandemics, and I've been working with AMR. And I think it really is so important because, as many people have said, people and behavior are really at the solution, at the center of this, finding the solutions to antibiotic resistance, not the bugs themselves. And so we really need to move away from the talking about the problem to talking about the solutions. And I think social and behavioral science can really help us to do that, because it can really help us to define what are the target behaviors that we're looking for in different audiences, and also to diagnose what are the barriers and facilitators of those behaviors, so that we can develop meaningful strategies and interventions, as well as tailored communications. So I think that behavioral science can really help us. And in particular, I think behavioral science provides us with methods and models and approaches that helps us to be able to collect and analyze data in kind of meaningful, simple ways, because often the people working with these strategies are not necessarily behavioral scientists or social scientists. They might be a microbiologist, they might be an infectious disease doctor in a hospital, they might be a communications expert. They might be somebody who's experienced one of these terrible infections. And so we need to be able to give people simple and usable tools. And then also I just wanted to stress the point that it's not just about behavioral science. Behavioral science helps us to understand individuals. That's including factors like knowledge, values, beliefs. We also need the broader social sciences to understand the context that our individuals, communities, and societies operate in. So factors like social and cultural factors, like social norms, but also environmental factors like physical infrastructure and facilities that can be barriers or facilitators to the change, the behavior change we're looking for.
Yeah. Thank you, Sarah. Thank you so much. Javier, and what role do you see for the veterinary sector to help increase awareness with the general public and the other way around? How can the general public push you, the veterinary sector, to follow best practices?
Yes, I think the starting point for both is understanding the problem. In the case of veterinarians, and this is more, I would say, a problem of advocacy or a question of advocacy rather than communication, is we have to make clear for them as well as for regulators what is veterinary medical use of antimicrobials and what is not veterinary medical use. And I'm saying this because in some cases, and I'm talking about regulation, this is not still clear. It's more a question of economical models, and this is why we have to play on different dimensions, and it's more a question of advocacy than a question of communication. But understanding the problem and the consequences and the economic data that were shown before, we hope that that can move the needle at the policy level. Then we have created some awareness documents for veterinarians where we explain what its medical use, what is not, what they can do, etc. We have to move practices from convenience to sustainability because sometimes it's much more comfortable when you have to treat mass of animals. It's much more convenient to do something like a blanket treatment rather than doing something targeted. So we have to work on that aspect as well. And the veterinarians play a very crucial role because they are in contact with farmers, pet owners, as well as legislators. In the terms of the general public, I would say the farmers, as I said before, that was a real, true experience. I was asking a farmer, did you know that? And he was telling me, no, but I'm not using antibiotics just because I thought it was a policy question. So I think we need to run more campaigns, and it's more like, it's similar as the ones that you can do with other patients in the sectors. And then one thing we have to work also with, and this is one of our main priorities right now, it's the pet owners. There are more than 1 billion pets around the world. It's increasing in regions like Africa and Asia. And the pet owners, when they go to the clinic, they behave like parents. And for those who are pediatricians, they might know the pressure that they can put on the veterinarian. You have to prescribe me something, huh? I'm not leaving the clinic without a prescription, okay? So it's a similar problem where I think synergies can be created, and I'm stopping here.
And Pablo, we've seen in that cloud the environmental world very big. So we need to do something.
Thank you all.
Right? How can we communicate this complex issue, the role of environment on AMR, to the general public?
Yeah, no, it's definitely not an easy task, and again, I might be echoing what colleagues have already said, but I think it's very important that we have a clear message, that we use relatable examples and stories when we're thinking about the environment. Stories such as, I don't know, let's say antibiotic-resistant infections that are linked to polluted water sources, for example, really help us bring that dimension into this space. We need to highlight best practices and have that strategic outreach. And then something that was also already said is I think it's very important to work more and more with social science specialists to understand what makes those changes in the behavior and really tailor the communication that we have to that. And also helping us, in that sense, change the focus sometimes of these complex issues that the health sector in general sometimes tends to address from a very anthropogenic perspective, which sometimes misses the bigger picture. And I don't know if we'll have time to address the next question, but I want to go to that because it was linking everything with the triple planetary crisis, and the question was around how this is useful or not in making the message potentially more complicated. I think it has its risks, and yes, we have to be aware that it could water down potentially, right, the messaging around AMR because maybe we're more familiar to crises like the climate change crisis, or all the, these connections that are drawn can make the complexity of AMR even bigger. But if we don't address it in the context of the triple planetary crisis, I think as I was saying, we're missing the bigger picture because all of these crises are essentially driven by unsustainable consumption and production patterns. I think that is very important to take into account. And if we don't address that, and we have tools to address that from a communication perspective, we can do layered communication. We can present AMR as a standalone issue, but with all these connections coming afterwards, right? I think that's very important. But let's not miss the bigger picture because, this is also a systemic issue. So I just wanted to make that clear. Sorry for taking the time.
No worries. Actually, it can even help us to simplify the message because, for example, climate change is a problem that people already understand a little bit
Definitely.
more than AMR, right?
Indeed. And also, one more thing. Sorry, I'll stop here. But I think it brings the policy coherent element to this whole issue as well. And when we're talking about the One Health context, One Health is just an approach. And I think it's an approach that really tries to embrace that policy coherence aspect. I think that's really central to all of these, right, systemic crises that we're dealing with here. Thanks.
Thank you. Very quick last question for Vanessa. So Vanessa, how do you think that we can more effectively communicate the personal impact of AMR?
The first answer is obviously obvious. This is something that I've been doing for a very long time is, telling my story far and wide in different realms. I think what's important to understand about storytelling is that it can be at different levels. So whether that be in policy making, whether it be in medical education. So for example, the hospital that actually saved my life, Charlotte Maxeke, Johannesburg Academic Hospital, started an antimicrobial stewardship team and asked me to go share my story with the nurses and the doctors. So again, it can be used in different contexts, not just in a policy-making meeting, and that'll also depend on how comfortable that person or that patient is at the very many levels that they can participate. I think what's really crucial, and I know Elena mentioned it early on, and this is why we ran our capacity development workshops together, was people, when I started my advocacy, I applied for a scholarship at Stanford University. And I wasn't very sure how to effectively tell my story on stage because I had to talk about a 10-year experience, 3 years of, failing surgeries during that 10 years, facial reconstruction, and break it down into 5 minutes. So what they did with me was they got me to write my story over and over and over again until it was 750 words, to be able to then present it in big meetings like the United Nations, which I have now done. So capacity development is extremely important. Then also we need to consider the genuine barriers to participation. They're going to be very different in the global north versus the global south. And when I talk about that, it could, for example, be cost implications to get to events, and so on. For example, in South Africa, when you're looking at the UK, we're looking at, say, £12 an hour. In South Africa, people live off sometimes £10 a day. So that can be very expensive to take part, which is why I also try and promote the virtual and the hybrid option when they storytell. Stigma is a huge barrier to that, which we need to bear in mind. In South Africa, that's quite, it's quite common because of the especially in the TB community and the HIV community and so on. And this is where patient stories actually work quite well in terms of mentoring other patients to come forward and share theirs as well. And then I think just to add, there's so much that I could add to that, but I know I don't have much time. The last thing is, I think that we need to have some kind of guidance to be able to work with patients in each country. So, for example, in the UK, we've got something called the NIHR Involved document. And that's been extremely helpful, I think, for a lot of patients to be able to work with researchers. It just kind of sets a standard in terms of, how they can come forward and share their stories. So, yeah, I think that would be it.
Thank you, Vanessa. I don't know if we have questions from the audience, or Christine, do you have a question? Okay, go ahead.
Let's see. Does it work? Excellent. Now, yes, thank you very much. This has been very engaging and very interesting. So just a comment at first, though. I think we need to be careful about saying that AMR is climate change or relating it to climate change, because AMR is not planetary. It's not threatening the planet. Homo sapiens, we've been on the planet now for 200,000 years, right? We've had antibiotics for 100. So we need to be careful because factfulness is important, but absolutely systematic change. But I have a question for Javier, because we want animals to be vaccinated. And we know that that can be expensive. And so is there the ability to do some sort of labeling on products that use veterinary vaccines rather than antibiotics? Has this been discussed? Because, perhaps consumers would pay more. Maybe our symbol's not the right one because maybe they think that antibiotics have been used for that, but another symbol that could be used to show that these vaccines have been used. Thank you.
Yes, this has been done. There are some cases in the US, some parts of the poultry industry, they have already replaced antimicrobial use by vaccination, and they were labeling the products as, I do not remember, but something like, never seen an antibiotic in my whole life, something like that. So it has been done. One of the things that came out from the political declaration, one of the commitments was to ensure that countries implement vaccination strategies against priority diseases for which vaccination can reduce antimicrobial use. So this is the target we are focusing on right now to promote that, because it will mechanically help to achieve the target on reducing the use of antimicrobials. The economic model of vaccines in animals is some sort of broken. It's similar situation like the one the human sector has with new antibiotics. It's something that we are starting to work on with the different stakeholders, trying to unlock the potential of vaccines and to fix this economic model. The figures that were presented by OECD, they include farm hygiene, but they could also include vaccination. The cost of vaccination and how this could relate to downstream cost savings in public health. And then, to circle back to your question about climate change, there are some studies, and there is even a report from FAO, which is showing that healthy animals have a lower contribution to the greenhouse gas emissions. So I think there is a link that can be made still to climate change, trying to point out to the fact that healthy animals do not need antimicrobials. This is what my colleagues from Sweden say all the time, and I agree with them. And there are some linkages between the abusive use of antimicrobials and having healthy animals and healthy people with the climate change. So.
Thank you, Javier. Thank you all. Thank you, Christine, also for your question. Unfortunately, we don't have time to answer questions from the audience, but we will make sure that those questions are addressed after the meeting. Now, I thank you, Sarah and Vanessa. Bye-bye. See you soon. Let's keep in touch. And thank you, Javier and Pablo, too. Now let's go to the next segment of our Raising Awareness session, and I have the pleasure to call Victor to the stage for GLOCAL communication.
Thank you. Good morning, everyone. We hope you're having a nice annual meeting. Let's continue talking about raising awareness, but of course, we have a video. Well, thank you. AMR is a global health challenge, as we all know, but as we can see these days, there are multiple fronts to face, and raising awareness is, of course, one of them. But how can we raise awareness? How can we communicate in a global world saturated with information and misinformation? How can we, from EU-JAMRAI, to contribute to increasing the understanding of AMR across Europe? So, well, this is our approach. Think global, but act local. We think it's necessary to develop positive, sensitive, and catchy proposals while overcoming obstacles like language barriers and different cultural mind frames. So for this reason, we are building an AMR communicators network with not only representatives from the countries involved in the joint action, but also from the stakeholders that may offer a global perspective. And through this network, we will suit the raising awareness action to the national context, for example, reviewing the translation of contents and materials, and ensuring that cultural differences are not an obstacle to an effective engagement. During the first year of EU-JAMRAI 2, the AMR Communicators Network celebrated its kickoff meeting. It is currently formed by more than 40 members from the 30 countries. And of course, we will keep on working to attract more communication experts to this network. And thanks to this network, we have already tested how to adapt global messages to national contexts. AMR Art and Memes was our pilot campaign for the European Antibiotic Awareness Day and the World Antimicrobial Awareness Week 2024. And through this combination of science, art, and a bit of humor, we tried to disseminate key messages on AMR in an appealing way. And, well, different members of the COM network assessed us with the contents, with the selection of paintings for the master version in English. And after that, the campaign was adapted to countries from the Mediterranean arc, France, Spain, Italy, and Greece. And not only that, but the contents were also offered in advance to the network, so different members adapted did their own translation, as they were the cases of Icelandic and Hungarian, for example. There were many others. And we received an excellent feedback for this campaign, but above all, it has been a learning experience to build up upcoming raising awareness actions. And what do we have planned for 2026? Well, there is scientific evidence that the combination of science and art as is an effective tool for communication. So this will be the basis of Sketching AMR, a campaign based on artwork and illustrations about antimicrobial resistance, where all countries will be represented by a national artist working with their native language. So the illustrations will be part of a European-wide digital campaign, but they will also be published in a multilingual album that will be at the disposal of the EU-JAMRAI 2 members as a resource for communication, education, and outreach activities. And besides that, a street exhibition will be created and will be displayed in different cities all over Europe. And how else could we address a raising awareness campaign, overcoming obstacles like language barriers? Of course, with a symbol, an iconic image that concentrates the message and that is visually meaningful. So the AMR symbol that resulted from EU-JAMRAI 1 is becoming more and more popular, and it's been adopted by healthcare authorities, policymakers. And in 2025, we will bring the AMR symbols to hospitals and healthcare facilities in a campaign targeted to engage with medical staff. But in EU-JAMRAI 2, we also want to raise awareness, targeting the roots, the foundations of our society. So we are planning actions and activities devoted to educational centers from different levels. So this year we will forge a new partnership with educators from all over Europe to spread the message of AMR among students from primary and secondary schools, as well at the university level. So thank you. And now I would like to invite experts to join the panel to discuss in more detail GLOCAL's experiences in raising public awareness of antimicrobial resistance. So please welcome Giovanni Mancarella from the European Food Safety Authority, and the members of the EU-JAMRAI 2 Common Network, Selma Bošnjak from the Croatian Institute of Public Health, and Rebekka Aldís from the Icelandic Directorate of Health, and also Edward Demicoli, that is joining us online. And the session will be moderated by Laura Alonso. So thank you, and Laura, the floor is yours.
Now? Okay, thank you, Victor. Welcome, thank you all. Hello, Edward, do you hear as well?
Well.
Wonderful. Okay, so thank you all for coming. I will start with Rebekka. Rebekka, you have already contributed to our campaigns, adapting our latest campaign, AMR Art Memes, to the Icelandic context, cultural context, and also to your language. What were the key factors that made this process successful and possible?
Hi, everybody. Thank you for having me. So in my experience, Icelandic people respond very well to humorous education, as we saw with the AMR Art Memes campaign. I think the humor makes information more memorable and shareable, and that's the reason we believe the campaign was a big success. A great example of successful campaign in Iceland is our annual prevention campaign for male cancer, which blends humor with useful information. So it has become very popular and is one of the most recognized public health campaigns in Iceland. So we immediately saw potential for the AMR Art Memes campaign to reach the Icelandic public well. Most Icelandic people speak English fluently, but we always translate government materials into Icelandic to make sure that everybody really understands the message that we want to convey. We translated 6 memes into Icelandic, and we adjusted the material to match the Icelandic humor to the material, and we actually saw an increase in our social media, and we saw that even some people shared the message privately on their own social media. So it showed us that humor and simplicity made the content even more relatable to the public. One key lesson that we learned is that humor is very effective, especially when it's paired with clear and simple actionable messaging. And moving forward, we want to reach different target groups, such as younger people, and possibly expand to other social media outlets, for example, TikTok. Thank you.
Thank you, Rebekka. Giovanni, building and maintaining a network, it's a hard task, and you have a lot of experience at EFSA. What insights can you share with us so we can apply it to our COM network?
Thank you, Laura, I'm very happy to share the EFSA experience, and I just wanted to mention that for us at EFSA, risk communication is really ingrained, it's enshrined in the founding regulation, in addition to risk assessment, and this is why it's so important for us to stress the efforts on risk communication. And we do have several network of communicators, and I wanted to mention the three, at EU level and at global level. So at EU level, we have the CEN, which is the Communication Expert Network. It brings together all the member states, and it's a place to share best practices, but also to promote the coherence of the messages across member states. And this is really important in case of food-related emergencies. And this is something that we've done for a long time, because it's one of the established scientific network of EFSA on communication. Then in the last couple of years, we have invested through a system of grants under the so-called framework, focal point operational framework, in some figures that are called member states communication coordinators that are support to help the CEN on the basis of an agreed list of action to promote this coordination. So this is a different scheme, a bit more on the transactional rather than voluntary scheme. And this is also an experience that we are monitoring, and I can make some example later. But for me, the other part is a bit the global aspect that you were mentioning, and EU-JAMRAI was coming to one of these meetings. We have another network, which is a global network called the IRCLG, so International Risk Communication Liaison Group. It's more of a community. It's global, brings members from Japan to Chile. It's non-exclusive, and it really brings these risk communicators in the area of food safety together to discuss about some issues like MR, but also plant health, World Food Safety Day, several issues. So you asked me about the challenges, and there are several, and most of them are, a repetition of things that we have been hearing from previous speakers. So the first one that I wanted to mention is, of course, cultural language differences, because it's about ensuring that the messages are properly culturally relevant and also communicated effectively in the various member states. We have experience of two pan-European campaigns, very big. One is called Safe to Eat, and the other is called Plant Health for Life. And in these cases, we have a very general audience, broad, consumer-facing in one case, and the other for plant health is very, very specific targets. But we see this happening, so we really need to pay attention to that. And the other thing I want to mention is, again, the coordination, consistency of the messages, because this was very, very much the focus of a recent regulation that we've had that changed a bit our frame. It's called the Transparency Regulation, and the Transparency Regulation coordinated communication between EFSA and the member states was really key. So for us, this has become really the focus of, these particular figures that I mentioned before, the member states communication coordinators. And the third challenge has been, of course, the capacity buildings and resources. So the resources is something that we try to fund through grants. And the capacity building is something that we are doing recently with a series of learning and development opportunities for these figures to invest a bit more in their capability skills to run campaigns effectively in a coordinated manner. And of course, the other successful strategy is what has been mentioned is social research integration into the work that we do.
Lots of things to learn from you. Really looking forward to see how this transactional model works, because national action plans are underfunded, as we have heard many times today, and many of them don't have communication teams inside. subcontract contractors to develop campaigns at different times of the year, but really looking forward to those results and how it's working. Selma, you have developed great activities with the AMR symbol in Croatia, and we wanted to hear your experience.
Thank you, Laura, for the invitation to share our experience. At the beginning of preparing our activities, we faced with several challenges. First was find the best place for our activities. The second was the best approach. And the third was to choose target groups. And we decided that will be the youngest children, school children, because we need to start our raising awareness of AMR from the start, from the youngest people. And the second group was elderly people who are mostly retired. And we know the life is expectedly increasing, and we have a lot of elderly people in our community. We organized a theater show for school children based on picture book, How Hedgehog Beat the Flu. And the children through the show were singing, laughing, and getting information how hedgehog beat the flu. Not with antibiotics, only with tea, lemon, rest, and that was our idea to be simple but powerful. And the messages from that show where the antibiotics, don't use antibiotics to treat viral infections, the fluids, rest, and symptoms relief are the best treatment for flu and common cold, and misusing antibiotics, making antibiotics, contribute antimicrobial resistance and make bacterial infections harder to treat. And for elderly people, and after that show, I asked them to draw something, what they remember from the show, and we shared our symbol, and it's amazing for me, and it's very interesting to one child from the audience said, "Oh, it's pill," and when she looks our symbol, the first impression was pill, and I said, "Oh, Ljungberg has a good point that put the red, white color on that symbol." And I want to share you some drawing picture from our children and what they...
Those are really cute.
And they are very satisfied with that show. And I think that we need to translate our scientific medical terminology to understandable message. And we also have, besides using social media, we should go to the community, and have interactive activities with people, talk to them, educated, and share information on the level that they understand.
Yeah. Thank you, Selma. That's right. That's our challenge. Edward, how do you integrate this local philosophy into the broader AMR campaigns that you develop, and what are, in your view, the main challenges balancing EU policies with local needs?
First of all, thank you very much for inviting me. And I'm sorry I cannot be there with you today. It would have been lovely to be in the beautiful city of Bilbao. So yes, as you said, our policies are global, but obviously when we communicate, we have to communicate in a local manner, and it's important to adapt, because we have different member states, different audiences, different healthcare challenges. So we need to bring our message down to the various audiences we're dealing with. When we have EU-wide campaigns, one of the best ways to do it is through multilingualism, through ensuring that we're speaking the language of the people, and it's not just the national language. Sometimes it's also the language that you actually use. So it's not just whether it's French or Spanish or Maltese, but it's also the kind of language that you use. When you're talking about something like AMR, it's the language that you use has to be something that is understandable. It's very easy, and we deal here in DG Sante with a lot of scientific topics. It's very easy to talk science, but it's also very easy that nobody understands you if you just stay at a certain level. In fact, for example, for one of our campaigns, we on AMR, actually, we used language which was spoken by teenagers rather than normal human beings. Let me put it that way. As a dad of two teenagers, I can actually say that. Also, it's important to partner with local actors. It's important to get your message down. We found it especially more so on social media. For example, if you engage with influencers, local influencers, not these global not just pan-European, global influencers, but actually influencers at a micro level, at the country level, we find that you get your message across. They tend to engage more with their local communities. Also engaging with the right people in the community, people like doctors, pharmacists, veterinarians, for example. If you're talking about the patients, we've heard all of this before, but it's important to go local. Challenges, there are a lot. I mean, we've heard a lot of them today already, and both this panel and the panel before. There are differences across Europe on AMR risk perception, differences across generations on what constitutes risk, misinformation and disinformation, a lack of public trust sometimes, a lack of public trust in science as well, which we feel that sometimes hinders communication. But the important thing is to adapt your strategies, be flexible. Flexibility is key to sort of empower the local actors to work in the community.
Yeah, and since
Thank you.
Thank you, Edward. I will follow the second question to you. Can you share a little bit your experience with the video game Beat the Bug, and how was, because you did it in 4 countries, right?
Six countries.
Sorry.
Yes, yes. It was a very chastising experience, a good learning process. It was the first time we were engaging in something like that. So just to explain a bit. So Beat the Bug was a campaign which we did, and at its core, we had there's a game called Fortnite. Anybody who has encountered a teenager in the last 5 to 10 years would know about this game. This is the biggest game that is played on an online platform, and teenagers play it all the time. And we decided to go on this game, and it was a very big challenge. It was a very big challenge for us, because it's not easy to boil down scientific knowledge into a game and into the game that already existed. So we weren't creating a game around AMR, but we're trying to instill an AMR into an already existing game. So this was quite tough. The reason why we did it is because we targeted an audience, a young audience, and we tried to do it with the interactive and the fun and the behavior-driven way. And we knew that traditional campaigns would not engage with this audience. As I mentioned, the language and the cultural adaptation were very important. Not only was the game, not only was there multilingual facets to the way the game was played and to all the social media around it, but we also sort of used the terminology that is used by young people. We never mentioned AMR, or it was about the bugs, and it was about the way to sort of engage with washing your hands, and it was very simple messages really, but we saw that they actually had an effect. The important thing is that we did, obviously there was the whole social media. I mentioned the influencers. They were very critical in ensuring that the word was spread amongst the audience that we're looking at, because they already have the audience. So we didn't need to find the audience ourselves. We went to the influencers who had the audience already. I mean, we had 13 influencers across the 6 countries that we targeted. And between them, they had 5.7 million views in countries. We're talking the 6 countries that we had targeted were Greece and Cyprus, Romania, Bulgaria, Spain, and Hungary. And in those countries, they had 5.7 million views. They played the game live, showing the way to play it, and that again had another 2.2 million views. People were actually looking at these influencers play the game. We launched around the game. We launched the competition, which then the results of which were announced during the European Antibiotics Awareness Day. Around 15,000 people from these 6 countries played the game in this competition, and we had quite a good social media reach with around 2.4 million on social media. But again, all of this, strategic partnerships, going local, we reached out to youth organizations, to schools, to social media influencers we actually engaged with and paid, and you try and amplify the campaign to reach the right audience. And obviously the metrics that we have and the lessons that we learned will help us shape our future AMR campaigns.
Wonderful. Thank you so much, Edward. Looking forward to see a report or the conclusions of this experience. Very briefly, Rebekka, how do you see the role of smaller countries like Iceland in this global goal of containing AMR?
Yeah, so even though Iceland has fewer resources and smaller workforce than larger nations, we can still play a significant role in the AMR efforts. We are small, but we are a well-connected nation, and it makes it easier to test innovative strategies and measure their impacts. By this, we can share valuable insights and sharing best practices and lessons learned within the JAMRAI team. We currently do not have any good information about AMR awareness in Iceland because studies are lacking, but antibiotic use is average compared to other European countries, but higher in Nordic countries. We have a challenge of convincing the public that AMR is a pressing issue, especially to our younger audiences who may not even see it relevant to their daily lives or future. This is the reason why we want to find the right ways to make our messaging more engaging and relatable, and finding the right channels. One advantage that we have in Iceland is we have a high trust in public health authorities and healthcare professionals, so it makes it easier to communicate and share science-based information. We also have a high level of internet and social media usage, and that means we can use well-designed digital campaigns to spread information. And also that we have in Iceland as a small nation is that we are really engaging with the public and participating in events, and we really want to take AMR from the digital space into real-life conversation, making it a household topic, so people can really communicate to people around them about the AMR and spread information in that way. So to conclude, every nation, regardless of size, has a role to play, and we can all make an impact on the global effort.
And we can learn a lot from making that process of making it an issue at household. Okay, well, I think that we don't have more time, unfortunately. Even for any question from the audience, we really need to close. We thank you all. Thank you so much, Edward. Thank you, Selma, Giovanni. And one question. Okay. Can we bring her a microphone, please? Thank you.
Hello?
Hello, it's Ivana from the European Commission again. As a part of the Polish diaspora, I live myself in Ireland. Polish minority is probably one of the largest, if not the largest. Similar situation, I believe, is in Iceland. I have personally visited Iceland. You have a lot of Polish people in Iceland. You mentioned this engagement with the public. I was wondering if you have campaigns directed to the minorities. You probably also, like in Ireland, have Ukrainians coming over. They might not necessarily speak Icelandic, they might not even speak English, and it's a different word. For the Polish, and I can say that as the Polish person, this trust is one thing, but our trust is rushing to the doctors on the first day of an infection and demanding antibiotics. So I just wanted you to comment on that. Thank you.
Thank you. Yeah, we have a large population of, for example, Polish people in Iceland, and in the recent years that we have now translated many of government and healthcare information into Polish to ensure accessibility. But right now we are just campaigning with Icelandic material, but it's a great point to translate it into Polish because we have such big population here. And yeah, I think that's a really good point, and I will take that into consideration and act on it. Thank you.
Thank you all. Thank you so much. I invite you to leave. I have the wrap-up very quickly. So this is the illustration for... So very quickly, because we don't have a lot of time, but we wanted to finish with, what are we expecting to bring to our next annual meeting in Vienna? So we are expecting to bring the results of our campaign, Sketching AMR, and of course, all the designs from the illustrators. We are hoping to see what was the result of bringing the AMR symbol into hospitals and healthcare facilities. We will bring the results of the studies that Anna has presented. And we will have a face-to-face meeting with our COM network members. And regarding our educators network, we have mentioned it several times during this meeting. We are not here to reinvent the wheel. So we already have an organization that has a great network of educators and a great project to bring scientists and science into the schools and how to integrate complex scientific issues into the daily work of our teachers. And we will continue to give visibility to our progress, and that's all. We thank you all and keep in touch. Thank you.